Today, we're going to differentiate the difference between a couple of the sleeping disordered patterns that happen at night. So, there's normal breathing, normal sleep, there's snoring, there's upper airway resistance syndrome, and obstructive sleep apnea. So, let's dive into just a couple of these so that you understand the difference and what we're talking about. Normal sleep, of course, normal breathing. You are sleeping, your mouth is closed, you're able to breathe through your nose without any trouble. There's no audible snoring or even audible breathing. Even if we hear people breathing at night, or even if you're sitting next to someone at a restaurant or on a bus or something and you could audibly hear people breathing. Usually that's a sign that, okay, something's not quite right here. But when we're looking at normal breathing, lips are closed. This is at night, well, during the day too, but normal breathing, quiet breathing, lips are closed. And there isn't a lot of restlessness at night. Basically, this is implying that the airway is staying open and strong at night. So then what happens next? What's the next progression? The next progression is snoring. Typically, we start to see snoring if the nose is congested. People start to have more trouble breathing out of their nose on a regular basis. Snoring is caused by a partial obstruction in the tissues in the mouth, in the back of the throat, in the soft palate start to vibrate. And that's what causes that snoring sound. You can have oral snoring where you can hear it through the mouth. You can also have snoring that happens if your mouth is closed and you're breathing through your nose. So either way, a lot of that is caused, it's that partial obstruction. Maybe the tongue is just starting to get in the way of the airway. The nose isn't quite clear, and it's hard for the body to control the rate of air that's coming in through the mouth at night. That contributes to the snoring. The next progression is upper airway resistance. And this is often what is found or experienced in children. And this is a little bit of a trickier topic because even if a child goes for a sleep study, upper airway resistance syndrome cannot always be picked up on a sleep study. So sometimes this has to be determined based on the symptoms. Now, again, there's a partial obstruction happening, and now there's more sleep disruptions that are starting to occur. So we might have things like bedwetting. We may have restless tossing and turning. Maybe the person or the child doesn't remember waking up a whole bunch of times, but you could hear them or you were aware of their frequent movement. The bed is really torn apart and, the blankets are a mess and the sheets are a mess. These are usually things that contribute or can be seen with upper airway resistance. So again, there's starting to be an obstruction to airflow. There's starting to be a physical obstruction, whether that's the tongue or other tissues, tonsils, adenoids playing in a role in the breathing at night. And these are usually signs when parents come to see me that they say they notice these things happening with their kids. They're snoring, they're restless, they're cranky when they wake up in the morning. Maybe they're wetting the bed or they have dark circles under their eyes all the time. They have trouble with keeping their mouth closed, so they're breathing through their mouth most of the time. And then we progress up to obstructive sleep apnea. And this is the one that everybody has heard of. But be aware that sleep apnea is being diagnosed in people younger and younger. It used to be the overweight male. That was the one being diagnosed with sleep apnea. Now it's being seen in teenagers and young adults who have healthy lifestyles and healthy body weight. It's not just about being overweight. Your structure, the way your skull, the way your mouth is formed, your structure, your tissues all play a role in sleep apnea. And the only way to diagnose that is with a sleep study. There's a lot of options these days now. You can do at-home studies, but You want to find a reputable company or a reputable doctor who's going to administer that test for you and read the results, okay? But generally speaking, when you have sleep apnea, your oxygen levels are dropping at night, there's some sort of complete obstruction to your airway, and an apnea is considered to be 10 seconds or more. The more instances you have at night, the more severe the sleep apnea is. So that's a quick rundown on some of the different sleep disordered breathing patterns that we see. And these are all things we help people with myofunctional therapy.